Department of Child Services. You've got a not lengthy list, but you've got multiple items to go over, but the hotline stats, some updates there, some older youth services updates, and then the prevention services resources that you're allocating to meet the need. And then, of course, we'll start with Dr. Box at the Department of Health for our on-the-ground, up-to-date numbers.
Thank you, Governor. Good afternoon, Hoosiers. Today, we reported 492 additional cases of COVID-19 in the state of Indiana, which brings to a total 28,255 Hoosiers known to have COVID. We unfortunately also saw 14 additional deaths. To date, 1,621 Hoosiers have died of COVID-19, and another 144 are believed to have died from this disease based on their clinical diagnosis. We've also seen nearly 184,000 Hoosiers tested for COVID-19. That number includes more than 2,000 people who were tested at 4 ISDH drive-through clinics this past week. We hope to see similar results with drive-through clinics planned for this week in Shelbyville, Wheatfield, Princeton, and Hammond. Details on these clinics will be announced in the next couple of days. To further increase testing, more than 24 additional testing sites have gone live around the state as part of our large-scale testing efforts. Currently, about 180 different locations around the state are providing testing, including these state-sponsored sites. I want to encourage you to get tested if you have symptoms, are an essential worker, are at high risk due to your medical conditions, your race, your ethnicity, or pregnancy, or a close contact of a high-risk individual who also you need to return to work. We have many opportunities available at no cost to you, so please visit our map and find the location nearest you. I also want to point out that our ICU beds and ventilator capacity are holding steady, with nearly 40% of our ICU beds and nearly 81% of our ventilators still available. I want to provide some other brief updates as well. Today is the first day in which the Indiana State Department of Health has overseen contact tracing for all 92 counties across our state. As I've mentioned, this is a huge undertaking, and I'm incredibly proud of the work that has been done to get to this point. 2 weeks ago, all but about 15 local health departments were doing their own contact tracing, and they will remain an incredibly important part as we go forward for taking care of these individuals who are isolated or in quarantine. Last week, ISDH began doing contact tracing for 21 counties, representing about 56% of all of our cases. Today, we're handling contact tracing for all 94 local health departments. So far, 2,250 new cases have been entered into the system. Nearly 3,600 outbound calls have been made. If you get a call or a text from the Indiana State Department of Health, please answer us or call us back right away. We want to make sure that we are helping you and those around you to remain safe. I also want to announce that we've had our first confirmed case of multisystem inflammatory syndrome in children, or MIS-C. This is a very serious condition which is similar to what we call Kawasaki's disease. Patients under the age of 21 present with fever, laboratory evidence of inflammation, and evidence of clinically severe illness involving multiple organ systems that requires hospitalizations. These cases have no alternative plausible diagnosis, and patients are positive for currently SARS-CoV-2 virus or have antibody evidence of SARS-CoV-2 virus or have been exposed within the last couple of weeks. This is something we're starting to see around the world, especially in New York City, which has reported greater than 150 cases in the United Kingdom, and now multiple states here in the United States. We've asked hospitals to report suspected cases to us as we can investigate and learn more about COVID-19 and how that may be impacting our younger people. We also need parents to watch for persistent fever in their children and contact their pediatrician if the child appears more seriously ill. In addition to the Indiana State Department health alert that went out to all providers, Friday, the CDC also sent out an alert to all providers about this particular syndrome. Finally, as more of our state starts to open up today, I want to remind people about the importance of wearing a mask and talking about other simple precautions that you can do to make sure that you protect yourself and those around you. Remember, you might not know that you have COVID-19 because you may have no symptoms. We've seen a significant amount of spread from asymptomatic individuals in our state and across the United States. Cloth face coverings can help prevent you from spreading the virus to others. Here's another way to look at it. My mask protects you, and your mask protects me. I know many of us are feeling stir-crazy, but I continue to urge Hoosiers to limit your risk of exposure by reducing the number of places that you go. Continue to order food in and items online if you need them. If you go to the grocery store, make sure you wear your mask, wash your hands carefully. And remember, always avoid touching your face and washing your hands after you touch things like ATM machines, gas pumps, or other high-touch surfaces. Taking this personal responsibility impacts how well we're going to do as a state as we gradually open up. So if you're a business, please make sure that your employees have masks. If you're a consumer, wear a mask when you're around other people. If we all take these simple precautions, then we can reduce the spread of COVID-19 in our state and make it a safer place for all Hoosiers. Thank you.
Thank you, Dr. Box. Terry, you want to give us your report?
Yes, thank you, Governor. Since the COVID-19 pandemic took hold in Indiana, state agencies have worked tirelessly to adapt their procedures to continue meeting the needs of Hoosier families. The Indiana Department of Child Services, its stakeholders and partners, are no exception. Our agency is entrusted with strengthening families, ensuring child safety, and providing child support services, and that work is ongoing. We investigate allegations of abuse and neglect, license foster homes, monitor children in DCS care, and take steps to reunify those children with their families or find them loving homes through the adoption process. In April, we stood alongside our judges to celebrate virtually as more than 200 children found their forever families. DCS is 5,000 employees strong, and more than 2,500 of those are frontline workers who are still seeing children and families every day to ensure their safety. We operate 96 offices across the state, providing a localized response to community concerns, and currently oversee more than 17,500 cases, including 13,000 children in out-of-home placements. In the past 2 months, our agency has opened 2,727 cases, down slightly from the last year's tally of 2,918. We know COVID-19 has put unprecedented stress on families. Many Hoosiers are confronting increased anxiety, isolation, underemployment, or unemployment. This makes our support for them more important than ever. Child welfare workers, both those from DCS and our service provider partners, have continued to put the children who need us first, and I'm immensely proud of the work they continue to do in the midst of the pandemic, behind the scene, heroes. They remain committed to our mission, even as COVID-19 challenges us to change the way that we do business. Before I talk about the adjustments we've made, I think it's important to highlight what has remained constant. First and foremost, we continue to investigate allegations of abuse and neglect reported to our hotline. While there has been much focus on ways we can all work remotely, it is important to note when a child's well-being is in question, a family case manager visits that child in person to ensure they are safe. In April alone, we investigated more than 6,000 reports in person. Our work today looks different than it did even a few weeks ago, and we continue to explore new ways of providing services. Like most state agencies, we have developed ways for many employees to complete their work from home and taken steps to secure personal protective equipment for those whose responsibilities still require them to meet with clients face-to-face. In an effort to slow the spread of COVID-19, we have limited office visits and transitioned many services to virtual platforms. At the same time, we have increased the frequency of those visits with our families in order to help them and their children stay connected. Throughout this process, we have increased communication with our service provider community to keep everyone up to date on best practices for reaching those who need us. We will continue to revise our practices and procedures as we learn more about what our children and families need. We are taking steps to expand our support of older foster youth, and we hope to provide more details on those plans in the coming days. These efforts build on the positive work our agency has already done to support these young men and women as they transition into adulthood. Most notably, this includes expanding services through the John H. Chafee Program for children who are aging out of the foster care system. With the support of Governor Holcomb and the General Assembly, we extended the age of eligibility for this support from 21 to 23 last year. Together, we have shown our youth we will stand beside them when they need us. While much of DCS's work is reactive, my hope is always to offer support before a child is ever abused or neglected. and we can't do that without the help of our community partners. DCS works with agencies across the state to support families at risk of becoming involved with the child welfare system. These organizations provide numerous child abuse and neglect prevention services, including food and utility assistance, transportation, and treatment for mental health needs and substance use disorder. These dedicated providers lift up Hoosiers in crisis, and I am incredibly grateful for their partnership. We also depend on you, our friends, loved ones, neighbors, to stand up for Indiana's children. Compared to April 2019, calls to the state's child abuse and neglect hotline dropped by more than 40%. And no, unfortunately, we don't believe this is because children are not being harmed. COVID-19 forced the early closure of schools and many community activities. Because of this, we provided tips for teachers so they could help be on the lookout for signs of abuse and neglect when they connect with their students virtually. Educational professionals, along with members of law enforcement, are the top reporters to the hotline. In short, we need your help. We have a collective responsibility to support families and keep children safe. We must come together to care for those in our communities who need us. Reach out to those who may be struggling. Offer to help. Small efforts, a bag of groceries, a kind word, can have big results. Thank you.
Thank you, Terry. Peter, the Bureau of Motor Vehicles has had to do things differently as well.
We have, sir. Thank you for the time. 2 weeks ago, we came and announced that we were opening 55 branches across the state to start serving Hoosiers. At that time, we had 17,000 appointments on the books. Last week, we had 141,800 appointments on the books, and that is at almost 100% capacity of the available appointments. And so our team has gotten creative in opening an additional 73 branches last week, and now today want to announce that we're going to add another 2,000 appointments a day to try to help make sure that we have enough supply for the demand that is out there to do transactions in our branches. Our team wants to do that in an intentional, thoughtful way so that we're maintaining the safety of both of our employees as well as the Hoosiers that are coming in to visiting, but feel that we can do this safely and add over 13,000 appointments a week in the coming weeks. And I've also opened up the appointment system through June 13th so that people can make sure that they can get their appointment scheduled at the closest branch. The other thing I would like to remind people is that you do not have to go to the licensed branch that is in your county. You can go into any of the 128 branches across the state, as well as don't forget about mybmv.com or in.gov/BMV as an online tool to where you can do transactions.
Thank you, Peter. Rachel, before we jump right into the Q&A portion, we used to say in the Navy that every day was a holiday, every meal was a banquet, and that was an attempt to kind of keep our morale up in challenging times. And that just reminds me, it seems like every day or every week we're recognizing some heroic organization or association or the workforce that's really seen us through this period of time. And it's just fitting that this week is the National Week for EMS. And we would not be where we are today but for all those heroes out there on the front lines. They define what the front line is, literally. And I just wanted to thank everyone in the EMS personnel whole network for literally burning the candle at both ends. And for, I mean, when you're calling 911 or when you're calling out for help, no matter what day it is, that's the first responder that's taking you from point A to point B. And hopefully that ultimately is not just going to save the day, it could save your life. And I just wanted to recognize everyone in that role that springs into action, and all of their maybe self-interest is set aside so they can tend to yours. So thank you. Rachel, let's go right to the Q&A.
Kayla Sullivan, WXIN.
Good afternoon, Kayla.
Good afternoon, Governor. State Representative Lisa Beck is calling on you to reform IOSHA after she says federal findings suggest IOSHA coached a company on how to get a lesser consequence. How do you plan to address this? And would you consider her suggestion to create an oversight panel for IOSHA on top of the federal inspections that are already required?
IOSHA, the Department of Labor, is conducting business as they should, and they will continue to investigate any claim or accusation that comes their way. I have full faith in their duty and their job that they're doing.
Brock Turner, WTIU.
Hello, Brock. Good afternoon.
Good afternoon, Governor. Thanks for taking the time. I just had a question, and I'm not sure whether this is for you or for Dr. Box, but with 90% of Indiana nursing homes being owned by like county hospitals, that would make them local units of government, and they're being heavily dependent on public money. I guess like, does the state plan to make more nursing home or long-term care facility data available to match what other surrounding states are doing in terms of like county level data or data with specific facilities?
Brock, it could go from me to Dr. Box to Dr. Dan, and we'll just start with Dr. Dan and see if he can answer the whole question.
Thank you,
Okay,
Dan.
I know there was a lot there, so
No,
thanks.
that's good.
So, Dan Rosiniak, Chief Medical Officer for Family Social Service Administration. So, in terms of the data that we're collecting and how we use the data, so we have, through the executive order, asked all long-term care facilities to report data to us on cases and deaths in their facilities. And the way we use that information is really to inform our strike teams. And so we're getting that information and looking at where are there long-term care facilities that have active outbreaks. And there are the places that we send both infection control and our strike teams in to help further delineate where the outbreaks are and how those facilities can then appropriately cohort. In terms of the relationships between county hospitals and long-term care facilities, that is independent of the data that we collect. We really are looking more just at the individual facility from the patient perspective, and that's where our focus has been and is going to be. CMS is certainly collecting and will begin collecting data as well from the long-term care facilities. We have made sure from the beginning that the data that we're collecting also matches with what the CMS data is, so that all that information that's going to be uploaded from long-term care facilities is going to align with what CMS is asking for as well. And I think and it will take, I think, some time for all of the long-term care facilities around the country to get into that system, to get registered, and to get their data uploaded in there. I think at that point there may be more data that's easy to compare across states, because keep in mind the data we collect and the way we collect it may be very different in the way other states and other regions and counties collect it. So I think once you have that uniform system, I think you'll see more comparisons across states.
Thank you, Brock.
Eric Berman, WIBC.
Afternoon, Eric.
Good afternoon, Governor. Couple of questions for you. First off, is today 2 weeks since phase 2 began. Phase 1 was the lockdown. 2 weeks since phase 2 began. Is the state doing anything to trace contacts and related illnesses from the businesses that had been closed until that day, from churches that began services, from the elective surgeries that began? Is there any effort to track that? And second, what is the state doing in response to the outbreak in Du Bois County, and is there a thought of tightening restrictions there?
Great questions, Eric. Realistically, when we look at this, we will trace cases when individuals are tested and come back positive. And then every single positive case will actually get a case investigation done, and we will then identify contacts, provided that individual is willing to work with us on that, and contact all of those contacts so that we can follow them also with regards to their symptoms and make sure they get tested if they're symptomatic. So that is how we would follow that out. We're not going just to a particular business that just now opened up and saying, let's test everybody there. The particular situation in Du Bois County, as you probably know, is related to a business down there. And again, it is one of our industries that has to do with meat packing. And so consequently, we have been very intimately engaged down there and doing that testing. To me, it's very similar to what we had in Cass County, and that is that it can spill out more into the community, but some individuals that work there don't even live within that specific community. So we really need to look at all the counties surrounding that. When that is localized to a particular business like that, oftentimes just making sure that those individuals are isolated, that the particular business gets all the cleaning that needs to be done, the deep cleaning and disinfection, and then bringing them back after that 10 to 14 period time of days would be what would be appropriate.
Yeah, and I would just add that over the last few days, this is another example of the business and the local community, be it the health department and or the elected leadership there working hand in glove with us to make sure we are able to contain that spread.
Meredith, WLFI.
Meredith, good afternoon.
Good afternoon. How are you guys doing today?
I'm doing great. Is that me or you?
That's me. I'm sorry. My phone is always ringing. So my question is regarding Purdue University. They have announced that they plan on having in-person instruction in the fall. Other states and larger college systems across the country have announced they will not have in-person instruction or it will be limited. Is there any concern that Indiana could become a hotspot due to thousands of people from all over the country and the world coming to the Hoosier State? Is there a plan in place if this were to happen? And what is that plan? And then I also have another question. Last week you mentioned there's millions of dollars being put into access for rural internet. This has obviously been a problem for years. Why did it take a global pandemic for some of these companies to finally step up and provide the internet access that these rural counties have been asking for years?
I'm going to take the first one and I'll take the second.
So I'll address the Purdue University question. I have not had any direct conversations with Purdue University, but I do know that they are one of the sites that we'd like to increase testing there with their facility. So I think, I feel certain that the administrators and those individuals that are running Purdue will be very much on top of that. I know that Tippecanoe County is one of our health departments that's been very actively engaged with regards to managing positive cases. And so I have great confidence that as we work together at the state level and at the county level with Purdue, that we would be able to address this. Certainly bringing individuals from all over the world and across the United States brings the opportunity to bring infection in, but then we have infection right here in the state of Indiana also. So that is something that we'll be working very closely with the locals.
Yeah, and I would just say, Meredith, that every state's going to grapple with that over the next few weeks as we get closer and closer to going back to school. We'll put out guidance in terms to back to school efforts across the board, not just Purdue, but for every school in the state of Indiana. We're working on that as we speak. In terms of your other question, you're right. We talked about, I think it was last week, that the state of Indiana has set aside $100 million to bridge the digital divide. That is making sure there are connections along with the partnership of our providers that are here in the state of Indiana, making sure there's a bridge there for folks who don't have access and service to the proper speed of internet service, broadband internet service. And so that's what that $100 million is for, is to bridge that divide. I think what you're referring to are areas where there is service, correct me if I'm wrong, but where there is service, but maybe the bills haven't been paid, et cetera. And there are a lot of local efforts all over the state of Indiana that during this time, if bills aren't paid, those, in fact, our local providers have stepped up to offer a connection there as well. So just another kind of shining example of folks stepping forward to try to help those who are in need. That doesn't mean that those past unpaid bills are washed away, so to speak. That just means that the state of Indiana is trying to make those connections where they don't occur already.
Abdul Hakim Shabazz, Indy Politics.
Afternoon, Abdul.
Good afternoon, Governor. A couple questions. Number one is the utility companies and what they've been asking the URCC to come back and maybe raise rates. Any thoughts on that? And number two, I don't think anyone's asked this in a couple of months. What about our rest areas? Are they, good, safe, clean? You have lots of folks coming back and forth across Indiana, back and forth. What are we doing to make sure those stay clean and stay useful?
You want to take the second one, I'll take the first? Okay.
So I have not specifically spoken to, I imagine it's Department of Transportation that keeps those clean, but I am confident that they are making sure that those are clean, that there is plenty of soap in those buildings. And, you know, obviously they need to stay open because people need to stop. The trucking industry is very critical to what happens for the rest of the world, the rest of the United States with regards to delivering the food goods and other things that we need. So I have confidence that they're doing a good job with that, but I have not had a specific discussion about that.
Yeah, we can get a report, an update on that, but I would echo that. Usually when you stop at a rest stop, that's essential. And we'll get Joe McGinnis Abdul to come in and give a report on some traffic studies as well, because as we're moving through these different phases, we are tracking travel, whether it be in-state or out-state. But you bring up a very good point. I was talking to the governor of Massachusetts not too long ago, and he was talking about the first cases that they knew about were on an airplane that flew in from Europe, and it just went from one to a massive spread very quickly. And so being the crossroads of America, we are tracking all of our travel, whether it be on the road or in the air, which is about nil right now. Your first question was about the IURC. That's the proper place. They'll make the decision, the IURC, on those, all those utility cases.
Dirk Wayne, 15 News.
Good afternoon.
Good afternoon, Governor. Thank you for taking this question. On March 4th, it appears an out-of-state executive with Optum Health made a $50,000 contribution to your reelection campaign, a dollar amount among the top 3 for any individuals. Weeks later, Optum Health, of course, given a $17.9 million fast-track deal to test for COVID-19. Could you recap your involvement in selecting Optum Health, your relationship with Grant Verstandig, and explain why Hoosiers might look at this with some suspicion?
I had no involvement in selecting that. Do you want to talk about the process?
Right. The governor was not engaged with that at all. I can say that we did work with about 7 different companies and basically asked them to give us, because we needed to stand this up very, very quickly, quotes with regards to how they would be able to stand up this type of a call center, testing, and then be able to do that testing in a very quick manner. Optum was already a vendor for the state of Indiana and had a good track record with us, and that's why Optum was chosen, but the governor was not engaged in that at all.
Sherry with the Indianapolis Star.
Afternoon, Sherry.
Good afternoon. Dr. Box, I'm wondering 2 questions for you. One is, can you give us any more information about the first case of pediatric multisystem inflammatory syndrome? What region of the state? Can you tell us if you're going to be tracking how many of those cases we're going to be seeing or potentially seeing here? And also, I'm wondering if we're also tracking the number of individuals that are going to be recommended to go into quarantine as a result of the contact tracing, because that could also give an indication of the impact of coronavirus on the state at any given time.
I know that with regards to the contact tracing, we have some set metrics out, and I'm not sure if the number of individuals that we put into quarantine is one of them, but I can look into that for you, Sherry, and actually make sure that you're able to get that information. The other question that you had, the first pediatric case. So I purposely did not ask from what part of the state that this case came from, because that being only one case, obviously we have to really protect that. I will tell you that most of these children will end up hospitalized in our biggest children's hospitals in the state. And so oftentimes they may be hospitalized here in central Indiana for that.
Nikki Kelly, the Fort Wayne Journal-Gazette.
Good afternoon, Nikki.
Good afternoon, Governor. I have kind of a 2-part question. Well, the first is very basic. I know we can't have sports leagues yet, but a lot of teams are starting to practice.
Yep.
Because they have less than 25 people.
Yep.
So if that is okay. And then secondly, did you actually think about mandating masks for citizens? And if so, why didn't you? Just a couple of days ago, there was an employee attacked at a 7-Eleven for making someone wear a mask. And I'm wondering if it was a state rule, if it would maybe take some of the heat off businesses.
You want to take the second one first, and then I'll go with our first question?
With regards to
Yeah,
mandating?
Mandating, and how we didn't go down that road.
Right. We did not go down the path of mandating the masks. I do think it is very easy for a business to mandate that, as just like they would shirt or shoes. I mean, there are many, many businesses that say no shirt, no shoes, no service, and I think no mask could be very similar. And I think that they should represent the importance of wearing a mask themselves by being masked. And that's what I see most of the time, but not all of the time. There are some individuals that get claustrophobic and have issues issues with wearing a mask, and it's just not something that they could do. So I think the importance there is that they just really need to socially distance themselves from individuals and limit their times where they actually go into retail businesses. But we did not ever plan to mandate that.
And we are, Nikki, as you point out, very aware of the calendar and the sports season that's right around the corner, if not here already. We will be making some updates to the executive order come the end of this week, but we're getting closer. And matter of fact, after this press conference, I'm meeting with all the docs, and there are many of them, because I have some outstanding questions, but what you bring up is one of them. I want to make sure that next steps that we take, either accelerating or deaccelerating, are done safely, but sports leagues, practices, we are contemplating that right now, and you can look for some updates in 2 days on Wednesday that will kind of forecast where we're going as we enter stage 3.
Elizabeth Binion, WNIT Public Television.
Good afternoon, Elizabeth.
Good afternoon, Governor. I have a question for Director Stigdon. Are virtual visits being used to follow up on reports of neglect and abuse and to monitor ongoing cases of court-mandated visits? If so, what happens when DCS has planned a virtual visit but the family does not answer the phone or the video call? And what role do children play in virtual visits, given the difficulty of providing privacy for children to talk with DCS staff members under such conditions?
Thank you for that question. To clarify, if there is an initial allegation of abuse or neglect, those visits occur in person, not virtually. Virtual visits are reserved for monthly visits with foster parents and with children and with families that already have cases open with DCS.
Whitney Downard, CNHI.
Good afternoon, Whitney.
Good afternoon. I had some questions on the distribution of, and I'm going to say this wrong, remdesivir. Last week, Dr. Box said that, half of it was going to a northern Indiana hospital and the other half was going to be distributed by ISDH. I was just going to ask, are you releasing what hospitals are getting this treatment, and what kind of guidance are you giving to hospitals when distributing this experimental drug to the worst cases? How do you determine what is the worst case, and what sort of factors do you consider?
Those are very good questions. The federal government distributed a certain amount to a northern Indiana hospital based on that county being considered a hotspot, based on their number of cases per capita of individuals. And then the state got a smaller allocation. So we were able to work with that particular hospital system to then be able to fulfill the needs across the state for our most severely ill patients with COVID-19. Shortly thereafter, we got a much larger infusion of remdesivir from the federal government, and were able to actually give the amount needed or requested by every hospital for their moderately or severe ill patients. The definition of a moderately ill patient and a severely ill patient is pretty well outlined by Gilead, the particular company that makes this drug. And so we have asked, as now the federal government has asked, that each hospital report to us their number of COVID-19 cases, whether they're moderately ill or severely ill, and if they would like to receive receive remdesivir. It is, as you point out, an experimental drug, and it has shown some positive effects in that it has decreased by about 30% the amount of time that an individual spends in the hospital. It may have some improvement in the mortality, but that was very marginal. So as this drug is used, there are very, very specific people and how they qualify for the use of the drug, very specific counseling and consents that have to be signed in order for the family or the individual to receive this drug, and then very specific information that has to be collected about how that individual does, and also if there are any adverse effects.
Rob Burgess, the Wabash Plain Dealer.
Afternoon, Rob.
Afternoon, Governor. Good job on asking questions, fellow journalists. You took all of my great ones. Dr. Box, you mentioned masks, but what about exercising in masks, either indoors or outdoors? Does that make breathing too difficult?
So I do not think if you go for your run outside that you necessarily have to wear your mask. I would ask that if you are on the sidewalk and you're approaching a group of people, that maybe you step into the street or you step up onto the grass or wherever so that you can give that 6 foot distance. I think that it's really hard to exercise in a mask, especially if you're running. And I would say that when you're working out in gyms, that if we do the appropriate distancing of 6 foot, we should be okay with that. But again, that is probably where my bigger concern is in the inside and then wiping down all that equipment afterwards.
Tom Davies, the Associated Press.
Afternoon, Tom.
Hello, Governor. With the outbreak in Du Bois County, how many of those cases have been linked back to the Far Best Farms facility there? And then it's been a couple weeks now since the widespread testing up at the Tyson plant in Logansport. How is the situation there with the number of illnesses? Have there been many severe cases and deaths tied to that outbreak there?
No, fortunately, the cases up in Cass County, fortunately, the average age of those individuals was 40 or 42, I can't remember. So most of those individuals have done extremely well. The Du Bois County, I believe, was 91 of those cases were associated with that particular meat packing plant, but I can get the specifics on that.
Kathy with the Ferdinand News.
Afternoon, Kathy.
Good afternoon. I'll have a follow-up with that Du Bois County question.
I bet you do.
I believe it's 42, but it's gone up exponentially in Du Bois County over that number. That was what we, anyway, had heard was at the plant that's under discussion here. But my question, and this has been asked by readers who've emailed me and asked this, what would it take to back off and make it more stringent, since these are growing exponentially? There has been some concern. I, of course, see people behaving badly all the time without masks and in very large groups, which concerns me. But people are a little worried about this. Would that fall to you, Governor, or would the county commissioners need to make that call, or how would that work? And then my second question is, we also have the Spencer County leader in Spencer County, where there is no hospital. And I'm wondering if there would ever be a chance of opening a special site there. For Spencer County, if they go west, it's Warwick County, there's issues there. If they go north, Du Bois County, we have issues. If they go south, they land in the Ohio River. So they could go to Perry County, I suppose. But just out of a safety concern, is there any chance of putting a testing site there? Because there is no hospital there.
Yeah, I would say, Kathy, please do not swim to Kentucky to get care. We have it in your district. You might want to touch on how hospitals are networked in districts, not just a county.
So I don't have the picture in my mind of Spencer County on the map, but our goal is to make sure that there is testing available in every county, and oftentimes more than one testing site. So I can specifically look at that map for you and see what testing we have available, because we do want that to be accessible to individuals. With regards to working with particular counties and their numbers, this has been something that the State Department of Health, in conjunction with the local health department, in conjunction with the hospital systems in those areas, we have worked very closely in many parts of our state to decide what is best for a particular community, and really want everybody to be on the same page, because that's critically important as we're looking at numbers, whether that hospital system is capable of managing that number of patients and what other hospital systems in the region might actually need to be engaged.
Yeah, it's a team effort, Kathy. It's not just me, by the way, it's us. But as Dr. Box just stated, we're in close consultation, and this is a shout out to Mayor Spinner, because I've talked to him, been in contact with him 2 or 3 times in the last 2 or 3 days. And you've been with the Department of Health down there, the local Department of Health. So Kathy, it's not any one indicator, it's a bigger equation.
Lindsay Erdody, the Indianapolis Business Journal.
Good afternoon, Lindsay.
Good afternoon, Governor. Wanted to ask more about the contact tracing. Dr. Box mentioned that we're up and running in all the counties now, but so does that mean that we've hit the 500 employees that are, or workers that are trained and hired to do it? And then also wondering if you could comment on why only 500. You know, a national industry standard suggested the state would need much more than that, about more than 2,000. So why only 500?
So again, I want you to remember that the local health departments, we're already doing contact tracing, so we have that entire workforce there. The 500 was the number that we felt that we needed to start. And yes, we have onboarded those 500 individuals and worked through the weekend, and actually we're calling patients and calling individuals who were positive or contacts over the weekend, and making sure that we were connecting with them already. So we will increase that number as we need. And again, we have metrics that we're looking at, and that is making sure that we are reaching individuals within that first 24 hours, whether that's their email, their text. So as soon as we receive that result, a clock starts for us in making sure that we are actually reaching out. And the way that the Hoosiers across our state can help out is if you get a text, if you get an email from the Indiana State Department of Health, if you get a call, please call us back. Please answer your phone, because that's how we're going to be able to do this most efficiently and most safely.
Justin Keel, the Westville Indicator.
Good afternoon, Justin.
Good afternoon, Governor. My question today is for Dr. Box. A community member recently speculated to me that cancer deaths and flu deaths had declined because those individuals were instead dying of COVID-19. The ISDH tracks death data statewide, and I figured this speculation should be pretty easy to check out. Would the ISDH consider publishing death data for all causes for the past several months so the public can see how COVID-19 compares to other causes of deaths? I think the most recent year for which data is currently available is 2017.
So we have a cancer registry, and I cannot remember how often we submit that data. It may be once every 2 years, but I can certainly check with my team to certainly look at that. There may be more than one cause of death listed on a death certificate, so it could be certainly someone who was receiving chemotherapy, say for lung cancer or something else, and then got an infection with COVID-19. So both of those would then, that would show up in our cancer registry also.
Brandon Smith, Indiana Public Broadcasting.
Hello, Brandon. Good afternoon.
Hey, Governor. I wanted to ask Dr. Box a question. So this is something that several listeners have asked us about here at Indiana Public Broadcasting. So you've been suggesting for quite a while now that folks who are in the high-risk populations should get themselves tested. But we've had folks in those populations who say they've been self-isolating really successfully, and they're scared that going out to a testing center puts them at greater risk, especially when there's not a drive-up center close to them. So what do you say to them about that sort of risk-reward calculation?
Then I would agree. I think if you've been able to isolate at home, you don't have to go out to work, you're getting your groceries delivered, you don't have individuals that are out in the public on a regular basis coming to see you or visit you. I don't know why you would need to come out and do that at this point in time. We do have a lot of other individuals, though, that are at very high risk, that need to go to their jobs, that do have individuals that live with them that go to their jobs. And if you remember from our data from the Fairbanks study, you were 12 times more likely to be positive if you knew that someone in your home was positive. So that is our concern with regards to that.
And we're taking the efforts. Optum, is an example, who we're working with now, 50 different sites, are safe sites. That's built into their protocol to ease their concerns, Brandon, that you're going from a safe place in your home to a safe site to hopefully give you more confidence that you're
Just like our hospitals,
Right.
we are trying to make sure that individuals are comfortable coming to the emergency room, comfortable going to their internal medicine doctor or their family doctor to get care. We are definitely making sure that that is a safe place to be.
And Brandon, you touch on an important point that as we continue to, and we will continue to expand testing, it will be, just saw a story last night that said that as states, not just Indiana, but as states, and we've been up about 6,700 tests yesterday. We'll be about that today. Imagining. But as states across the country ramp up or expand their testing capability, we're going to need people to get tested. It takes two to get that result. And so you'll start to hear us encourage, as we have, having sites available, people having access, but we're still going to need folks to go in to get tested.
Steve with KPC Media.
Afternoon, Steve.
Steve, you should be able to speak. We'll come back to Steve. Demetrios with WTWO.
Good afternoon, Demetrius.
Good afternoon, Governor. My question is about the pediatric multi-system inflammatory syndrome. So with the state reporting its first case, can you tell us how much, that will factor into the state's decisions on school in the fall, considering that children, can become seriously ill?
We have to remember that there are a large number of children out there that probably have been infected that did not get seriously ill, that this is a smaller percentage. Just like our tests being positive for individuals in the hospital, we'll probably tend to know more about those children that do get seriously ill. But we will be working with Department of Education this week specifically on their goals and desires as far as opening schools back up and making sure that health has input into that.
We'll return to Steve with KPC Media.
Welcome back, Steve.
Good afternoon. Hopefully this is working this time now. Just real quick with stage 3 potentially on tap for Sunday, I just wanted to check to see if there were any indicators that would suggest we're off of that mark, or if we're looking good to move into Sunday and maybe advance another step here.
Well, I'm not ready to turn any cards over. No, Steve, not trying to be coy, but we look at our 4 principles. We look at what's happening around the state in a very local or micro level, but again, we expand that out to the macro, the whole state, district by district. But I think I've got a number of questions that I need answered yet later today, but you can expect the update to come Wednesday to kind of give folks time to wrap their head around what potential changes there might be going into the weekend.
Thank you for joining today's briefing. Governor Holcomb's next briefing will be Wednesday at 2:30.
And you've been watching Governor Holcomb's update on Indiana's coronavirus response. More than 1,600 Hoosiers have died of COVID-19. State is also reporting nearly 500 new cases, bringing the total now to 28,255. And today we also learned that Indiana has its first confirmed case of multi-system inflammatory syndrome in children. It's a rare inflammatory syndrome associated with COVID-19. There has been an outbreak of this in New York, and it has started spreading to other states. Indiana health officials are warning parents to monitor their child's temperature. We'll have a lot more on that and other updates from the governor tonight on CBS 4 News at 5 and 6, and right now on the CBS 4 Indy News app.